Okay, we're talking about heart health medications, blood pressure medications that are associated with weight gain. So, pretty much, there's my phone dinging on me. Not editing these videos, just getting them out so you can use them. So, any medicine that ends in olol, rhymes with olol, propranolol, metoprolol, carbidolol, you can make a song out of it. All the olol medications, the beta blockers, can result in some weight gain. So the bigger offenders would be things like acebutolol, which I never use. I had actually one person come in last week on acebutolol from somebody else a gajillion years ago. I switched it. Atenolol, metoprolol, and propranolol are all potential weight gain type medications. I will say that some folks will use a very small dose of propranolol for migraine prevention, and I don't see that causing a lot of weight gain. So if you have high blood pressure and you don't have a history of heart problems, like blockages, heart attack, that kind of thing. You may have been started on a medication like, let's just say, atenolol. So it's not a great blood pressure medicine, but there are still a lot of people on that. Someone might even start you on metoprolol, great medicine, but maybe not the first drug I would pick for blood pressure in someone without heart disease. So maybe someone started you on that medication just kind of willy-nilly a number of years ago, and things just tend to keep being continued forward. So you might just look and see, hey, could we do something like a losartan, irbesartan, arbesartan, all the sartans. Anything ending in sartan is not going to cause weight gain. Losartan would be like the best example of just like a really easy, low side effect medication that's not going to cause weight gain. I really like performance medicine. I think performance medicine is really cool. Telmisartan actually was on the banned drug list for athletes because it really improved cardiac contractility, how well a heart functions under stress. And so some athletes looking for a little bit of an edge would actually do telmisartan. And they were not allowed to do that. I don't know if it's still a thing, but in the past it was kind of interesting. So lots of ways to skin a cat when it comes to blood pressure management, and most of those drugs don't cause weight gain. I think another thing to say about metoprolol and propranolol, atenolol, all the olol medications is, one, for guys, it can increase erectile dysfunction, and then two, it just, pardon me, frog in my throat. For anybody, really, it just makes it hard to get your heart rate up. The way those blood pressure medicines work, at least in part, is by slowing the heart down. So let's say you want to get your heart rate up to level 2 heart rate elevation, doing cardiovascular exercise, which I think is a great thing to do. It's hard to do that when you're on a blood pressure medicine, which makes it so you can't raise your heart rate. So again, that's just another thing. And if you can't raise your heart rate, you can't. It's hard to get that exercise in. So just another reason, if you don't have blockages and your doctor thinks it's okay, maybe moving from a metoprolol or a beta blocker type medication to an ARB or a losartan or related type medication. I think that also just it's worth talking about, just getting to the root cause of why your blood pressure is elevated. I mean, there's lots of folks who smoke, lots of folks who drink excessive alcohol, lots of folks with sleep apnea, and so those are kind of like the most common, or maybe excessive stimulant use. So if you drink like lots and lots and lots of coffee, lots of caffeine, all those things can raise your blood pressure. I think the most common things I see that are really hard to treat are folks who are overusing alcohol. And I think when if you're using too much alcohol, I mean the sort of the professional organizations would say, hey, you can have a glass of red wine a night. I would say you can't do that if you want to lose weight. You can enjoy your booze, or you can lose weight, but you really can't do both. Everybody gets a cheat day, but I would say that like alcohol is just empty calories, and if you overdo alcohol, it will cause you to have high blood pressure. Then you'll have to go chase that high blood pressure with a pill. Like, it's better just to reduce or cut out the alcohol altogether. Related, people who drink a lot of alcohol at nighttime, who have some weight to lose, have a tendency towards sleep apnea. So sleep apnea is just when you don't breathe good at night, in plain terms. And it's like, hey, if you're not breathing well, your brain sends out stress signals to your whole body. Your cortisol levels and stress hormones go up because your brain thinks it's suffocating all night long. So that does terrible things to your hormone levels, and also with that stress signal drives the blood pressure up. So untreated sleep apnea is something I see very commonly causing high blood pressure. So it's like, how do we get off these medications? Well, we cut out the alcohol. Like, if you drink a whole bunch, like, please don't quit drinking cold turkey, because that can kill you. But you want to cut it back slowly, cut it down, cut it down, cut it down, and eventually stop. That'd be great. I think your doctor will agree with that. Sleep apnea is going to be really important to treat as well, frankly. So most folks who are obese have a risk of sleep apnea that can be very easily tested for with a home sleep study. So you take a little thing home, you wear it at night, you turn it in. It's pretty dang easy to do. Treating sleep apnea will make it so that that blood pressure elevations caused by sleep apnea go away, or at least are dramatically reduced. So you may not need so much medication. Anyway, I think those are things to think about. You know, what are some root cause things that we can get to that eliminate the needs for medications that may be causing some of this weight gain. Hopefully that's helpful for you. I am going to, at the risk of beating a dead horse, as far as these medications go, have a really short video on allergy medications and similar medicines, and then we'll jump into our new topics. Thanks.